Choosing whether or not to keep the foreskin is a question that's been asked for generations. What once was primarily a religious or cultural tradition is now often a personal health decision, guided by scientific research and individual values. In an age where access to evidence-based information is easier than ever, understanding the real facts, free from myths and misinformation, is essential. This discussion isn't about what's right or wrong for everyone. It's about what's right for you, so let's explore it, factually and openly. We'll start by looking at what the foreskin is, what functions it serves, and why it evolved. We'll then cover the medical benefits of circumcision, the associated risks, and the specific conditions where circumcision isn't just a choice, it's a necessary medical procedure. And finally, we'll address common myths and offer guidance for those who are undecided. So, what is the foreskin? Medically referred to as the prepuce, the foreskin is a double layer of tissue that covers and protects the glans, or head, of the penis. At birth, it's typically fused to the glans and slowly becomes retractable as a child grows. It's more than just extra skin. It has three primary biological roles. First, protection. Like an eyelid for the glans, it shields one of the most sensitive areas of the body from constant exposure, friction, and irritants. Second, moisture retention. The foreskin helps maintain a naturally moist environment around the glans, which may support microbial balance and reduce friction during intercourse. Third, sensation. The inner surface of the foreskin contains thousands of nerve endings. Estimates range from 1,000 to 10,000 that contribute to erotic sensitivity. Most of these are fine touch receptors, similar to those found in the fingertips. Now let's look at the historical side. Circumcision has been performed for millennia, in ancient Egypt, in Jewish and Islamic traditions, and in tribal practices across Africa and Oceania. In the Western world, it gained popularity in the 1800s and 1900s, often promoted for hygiene and even as a way to discourage masturbation. Only in recent decades has modern science begun to carefully study its true medical impact. Today, many people consider circumcision for medical or preventative reasons. Let's examine what the research shows. One of the most straightforward benefits is hygiene. Without a foreskin, the glans is easier to keep clean. This reduces the buildup of smegma, a natural but sometimes odorous combination of skin oils and dead cells. Poor hygiene can allow smegma to accumulate, leading to infections or irritation. Speaking of infections, circumcised males have lower rates of certain inflammatory conditions, such as balanitis, inflammation of the glans, and balanoposthitis, inflammation of both the glans and foreskin. These can be painful, recurring, and difficult to manage without proper hygiene. In infants, circumcision has been linked to a reduced risk of urinary tract infections. UTIs are uncommon in males, but when they occur, especially early in life, they can cause serious complications. Some studies suggest circumcision can reduce the risk by up to 90% in the first year. Perhaps the most well-documented medical benefit involves sexually transmitted infections. Large-scale clinical trials, particularly in Africa, have shown that circumcision reduces the risk of acquiring HIV through heterosexual intercourse by about 60%. Organizations like the World Health Organization and UNAIDS recognize this as a significant public health benefit in regions with high HIV prevalence. Additionally, circumcision has been associated with reduced transmission of HPV, the virus that causes genital warts, and cervical cancer, along with lower rates of herpes and syphilis. Circumcision is also linked to a reduced risk of penile cancer, a rare condition that is strongly associated with chronic inflammation and persistent HPV infection. While penile cancer is uncommon in developed countries, its risk factors align closely with issues that circumcision helps prevent. Now let's talk about the risks. As with any surgery, circumcision carries a small but real risk of complications. Pain and swelling are the most common immediate side effects. Modern techniques and local anesthesia minimize discomfort, especially in newborns and infants. There's also the potential for bleeding, infection at the incision site, or cosmetic issues like uneven skin removal or visible scarring. In rare cases, additional corrective surgery might be required. The most debated issue is sensitivity. Since the foreskin contains nerve-rich tissue, removing it inevitably changes the anatomy. Some men report no change in sensation. Others say the glands becomes less sensitive over time due to keratinization, the process where exposed skin thickens slightly. However, studies are mixed, and sexual satisfaction overall appears similar between circumcised and uncircumcised men. Ultimately, it's a personal and subjective experience. So when is circumcision considered medically necessary? First, there's phimosis, a condition where the foreskin is too tight to retract fully over the glands. While it's normal in children, if it persists into adulthood and causes pain, hygiene problems, or infections, circumcision may be recommended. Another condition is paraphimosis. This occurs when a tight foreskin is pulled back and becomes stuck behind the glands, restricting blood flow. It's a medical emergency that requires immediate attention and, in some cases, surgical correction. Chronic or recurring infections, such as balanitis or urinary tract infections that don't respond to treatment, may also lead doctors to recommend circumcision. There's also a rare condition called balanitis xerotica obliterans, or BXO, which causes scarring and narrowing of the foreskin and urethra. In such cases, circumcision is often necessary to prevent further complications. Now let's clear up a few common misconceptions. Myth 1: circumcision prevents all STIs. It doesn't. While it reduces certain risks, condoms and safe sexual practices remain essential. Myth 2: everyone loses sensitivity after circumcision. Not true. Some notice a change, many don't. The experience varies from person to person. Myth 3: it's only done for religious reasons. While religion plays a role, modern circumcision also has clearly documented medical and preventative benefits. So how do you decide what's right for you? If you're a parent, you may weigh cultural, religious, and medical factors when deciding for your child. If you're an adult considering circumcision, the choice is more personal. Do you have discomfort, hygiene challenges, or recurring infections? Are you concerned about sexual health or appearance? These are valid reasons to speak with a medical professional. The foreskin serves legitimate functions, but removing it offers legitimate benefits. The important thing is that your choice is informed, based on science, not assumptions. And remember, circumcision is not a substitute for condoms, regular STI testing, or honest conversations about sexual health. If this helped you understand the topic better, give the video a like, subscribe for more fact-based health content, and share it with someone who might be asking the same questions. Thanks for watching. Stay curious,